Morning, everybody. In this session entitled Mobilising Communities on Alcohol Harm and What It Achieves, we want to do two simple things. We want to give you a quick overview of the pilot project that was run in the Northwest between 2009 and 2012, and we also want to give you a brief illustration of some of the work that's going on in communities around the country at the moment. To do that, I'm going to be joined by Karen Johnson, who is the Deputy Chair of the National Forum of Family Resource Centres, Donna Butler, who is the Programme Manager of Family Matters. They run the Strengthening Families Programme, and Hugh Greaves, who's the Coordinator of the Ballymun Local Drugs Task Force. So what is community mobilisation? Well, this is the definition, if you like, that we've used. Mobilising communities on alcohol is a comprehensive response to an issue involving a wide range of individuals, agencies and organisations that come together when that issue is too great for one sector to tackle alone. Now you can see on the slide a list of various sectors. That's our wish list. We wish to see all of those organisations and individuals involved in tackling the problems we have around alcohol. Community mobilisation is a community-driven method, but it's also one that is multi-level and multi-agency. It's concerned very often with geographically based communities, so all of the agencies working in a particular area in the country we would hope to bring together to have their input, not only in discussion, but also in what resources and supports they can lend to the programme. This was the pilot project run from 2009, December 2009 to June 2012. It was called Time for a Change Border Region Alcohol Project. It was run in County Donegal and the border area from Limavady in the north down to Fermanagh in the south, so it was that border corridor area. This project was one of 12 cooperation and working together projects that were run in the border area. They were all health-related projects. The project was funded by EU under the Interreg 4A programme, and I'd like to take the opportunity to thank both COT and the EU for their funding support that allowed this pilot project to happen. We've learnt a lot in the process, but we have a lot more to do. That the pilot project was timely is shown by how the steering group report on the National Substance Misuse Strategy that was published in February 2012 recognises that there is a need for a community-wide, inclusive and coordinated approach to promote greater social responsibility and prevention and awareness raising. High levels of social capital, which includes input from families, community engagement, volunteering and overall community spirit and identity, can act as a buffer against the harmful use of alcohol. Communities should be supported to develop the evidence-based skills and methodologies to implement community mobilisation programmes with a view to increasing public awareness and discussion of alcohol problems. And most of all, to build the community capacity at local level to respond to alcohol problems in their own communities. Our belief that mobilising communities is fundamental to fulfilling the objectives of the National Substance Misuse Strategy is based on the experience of the pilot project and the learning during that period. The work of the Alcohol Forum in mobilising communities supports the recommendations in that steering group report. The work consists of commissioned research, seasonal awareness raising campaigns, family support programmes, training and awareness raising events, and products specifically developed to support communities to mobilise on alcohol harm, and to do so under the 4 strands of education, prevention, supply, treatment and rehabilitation. These are some of those resources. Now there's quite a few, and quite a few of these have been developed specifically according to needs identified at community level. Now, I'm not going to go through them all because that would take too long. All of these resources, and there are flyers about these resources, they are printed up nice and big on a red stand out in the lobby beside the registration desk. So if you want to have a look further, you'll see them out there. These resources are also available in hard copy. There are samples for you to have a look at, and they're also available on the website. I would like to take the opportunity to mention two of these resources. The first I'd like to mention is Moville Family Conversation. I've picked this one out because this was a little method to support families around alcohol harm that was developed by a community long before our pilot project even took place. This was a genuine, real community response to a realization that all of us, everywhere in the country, have difficulty addressing our relationship with alcohol. We have difficulty broaching the subject with anyone we're concerned about, or our children, or a friend who we see may be indulging in hazardous drinking. Broaching that topic is very difficult. What happened in Moville was that the Family Resource Centre and local members of the community got together and thought, how can we make that step easier? How can we support people have that first conversation? And they developed this toolkit. It's very simple. It's made up of 2 questionnaires, one for parents or guardians and one for younger members of the family or older members of the family. Everyone fills in their own questionnaire individually, and then they come back together, read each other's, and they talk about it. It's as simple and as complex as that. This was a community responding to something. This, to my mind, is a very simple form of early or brief intervention. It's starting the conversation. This came from a community group without any support from anyone. Well, a little support, but not a lot. This came from a community, so I wanted to highlight that. Another resource that was developed specifically to support mobilising communities was the responsible server of alcohol training. This is a very intensive 3-hour training with a manual, with a sticker for the business to show that they are running their business responsibly and have trained their staff. The training is in 3 parts: awareness of alcohol harms, the law around sale and supply, because we have lots of laws, but amazingly a lot of us don't know what they are and don't know what the fines or penalties might be around sale and supply. The last section is about developing the skills to be better able to do your job safely and comfortably if you work in the licensed trade. And we have run this in the Northwest. One of the first places we ran it was in the Abbey Hotel in Donegal town. And I have a wonderful quote from the manager there. His name is Danny O'Donnell. Now, he's not the singer Daniel O'Donnell, he's another Danny O'Donnell. He told me that after 27 years in the business, he was amazed to find that the responsible server training helped him learn something new. And he was very glad that all his key staff had taken part. So that is the type of resources that are being developed to support communities. So if we look at the pilot project, this is where it took place, in Donegal. What we found in mobilising the community was that when you mobilise the community, you effectively, it effectively anchors and maximises work around alcohol harm, because it's involving local groups and it's exploiting the existing networks. When we support a community to identify its own concerns and then find ways to address those concerns, we create a sense of ownership at community level, on the ground, from the ground up. It is this sense of ownership that allows these types of interventions to continue and to be ongoing. On the map, you'll see lots of smiley faces. Each smiley face indicates a community that was involved in the pilot project. There was a very wide range of stakeholder organisations got involved in each one of those. And drawn from that wide range of stakeholder groups was a steering committee. And the steering committee, they worked with our support to identify the needs of that community and where the problem spots were. And they were different for different communities. Different communities focused and had different concerns and different priorities. From that initial identifying need. That steering group, with support, produced their action plan, as mentioned by Dr. Anne Hope, the need to plan in advance and the need for a multi-level approach. And then we worked together to implement it. One thing that we found, that we learned in the process of the pilot project, was that if we want to work effectively with communities and we want to get real ownership on the ground and get real communities and real people and real organisations locally involved, we need to have one or two key local organisations in that area who will adopt or commit to mobilising on alcohol harm, who take it on board to be the host, who take it on board to, at ground level, start to coordinate and pull together the existing services that can support mobilisation on alcohol harm. So in this way, that local organisation, one or two organisations, they form a framework, if you like, at local level to coordinate efforts. The pilot project basically piggybacked on those existing networks at community level. And this, again, was one of the recommendations in the National Substance Misuse Strategy, that we should use existing networks and supports as they are. To pick one project, one case study, this is a first slide of Donegal Town. Donegal Town, you can see, at its core, you had the Donegal Family Resource Centre, supported by the Alcohol Forum. All of those organisations around it, they all fed into this project. Some of them were very heavily involved, some of them quite on the periphery. But you had a lot of our wish list, if you remember our wish list of sectors, were in some way involved. This, to my mind, shows that when you kickstart something and you support communities to work around alcohol harm, that you can build up a very strong base of agency buy-in, because all of these organisations fed into it at some level. So to look again at Donegal, they were established in 2010. This was their first year. Now, I'm not going to read all that to you. Donegal is a case study. You can see it again as a case study and photographs of some of the work they did. And their community alcohol survey, etc. They're all out on a stand in the foyer beside the registration desk, so you can have a look at that in more detail. The first thing they did really was develop their steering committee. Then they ran their community alcohol survey. From their survey, they took some of the needs highlighted by members of the community and they developed their action plan. And they started to roll out those things that were highlighted. This was year 3. And as you can see, if you can read a couple of those little squares, you'll see that as we went into year 2, you can see there was more and more agencies getting involved. So it had, like, I suppose, like a ripple effect. Something was started, it was hard to get off the ground, hard to get people to support. But once it was moving and people saw activities happening, more and more people got involved. And more people were persuaded to get involved. Now, we could put another ring of activities around the outside, except my slide wouldn't allow it. But they have continued to work, and since then they have run festival care, responsible server training. They now run Assist twice a year. They run Safe Talks twice a year. So a lot of those resources from other agencies that did exist just are getting more focused now, and they are continuing to be run. This is just a slide of one event. I like this event because this is a youth event. It was organised nearly entirely by a group of young people in Donegal Town. We wanted to support them that summer because it was the first year that the recession was really hitting and there was no summer jobs and a lot of people were at a loose end. So rather than have nothing to do, we thought, well, what would they like to do? So we asked them. You know, people said, well, what would young people like to do? There's no point discussing what would they like to do, you have to ask them. And it turned out, in Donegal, young people were very enthusiastic about the Donegal Summer Festival. But they felt there was nothing in the festival for their age category or for young musicians. So their event was a battle of the bands on the Saturday of the festival. And we had, I think, 6 or 7 bands all from the area. who played that day. If you see, there's a group of young lads up there with white t-shirts. They were part of the organising committee. There was also 4 girls, by the way, but I could never get them in one place at the same time to take the photograph. So they were asked to plan a slogan for their peers around alcohol use. These are all teenagers. And the slogan they chose was, "Easy does it." So the day's theme was "Easy does it." And the young people involved made sure, we didn't, they did it, they made sure that it was an alcohol-free event to show that they could have a good time without it. So it was a wonderful example of what can be done. I'm coming to the end now. Mobilising communities moving forward. This map shows you the pilot project in orange faces. Current projects that are establishing at the moment are Tubbercurry, Ballymun, West Sligo and Mohill. And I'm glad to say there's a couple of community representatives here today from those areas. The blue faces, these are where community organisations that we have talked to about mobilising around alcohol harm have expressed not only an interest to become involved in mobilising around alcohol harm in their area, but they have made it very clear that they know what the problems are locally, they know something needs to be done about it, they know that it is impossible for them to fix it on their own, they know they need help, and they want support. Now, just you might be wondering why they're clustered in 2 areas, those blue dots. They're clustered in 2 areas because that was the level of interest that came out of 2 presentations to regional fora of family resource centres. We haven't got to the rest of the country yet, but this is showing me that there is a great need and an identified need at community level that we really need to tackle this problem head on, and we need to do it soon. Another point I'd make is the majority of key host organisations that were involved in the pilot project and in all those areas that are showing interest, the key group that is involved in hosting, mobilising on alcohol harm is a family resource centre. Now, not in all cases, but in the majority of cases. So we're very happy to be able to work with such a strong network at community level. And it's for that reason that I will now pass over with great delight to Karen Johnson, who's the Deputy Chair of the Family Resource Centre Programme.
Thank you. Thank you. I want to thank the Alcohol Forum for inviting the National Forum of FRCs to make this contribution to the conference. We're delighted to be represented here today, and I'm delighted that I'm definitely not on my own from the family resource centres here. There are several FRCs here today. Family resource centres work to provide family support that is universal, as well as activities and services that focus on prevention and early intervention in any area of life. We work with people from cradle to grave, and our doors are open to everyone in the community. By supporting and strengthening individuals and families, we build a strong community. That is what we believe in. The work of family resource centres is based on community development principles. We are in the community where people live. We are of the community with the needs and the wishes of the local community guiding our work. And we are community-led, with local residents making up most of the members of on our voluntary boards of management, deciding on the directions and the work of each local family resource centres. We work in partnership on every level. The Family Resource Centre National Forum networks and partners with other organisations on a national level, like here today. The National Forum, as you will see from the map, have 8 regions, and a lot of the work is happening on a regional level, where FRCs partner with each other and then partner with appropriate groups, organisations and agencies on a regional or a county or an area level. And you can see how important the regions are, because that is where Anne and others have been able to really reach the local FRCs. Information always flows in all directions, sometimes from the national level to the regional to the local, and sometimes the other way around. The three levels are all as important and feed into each other. And now that I've introduced the FRCs, you will see how much sense it makes for the family resource centres to partner with you here, because we all work from a background of community development principles, and we work on mobilising the local community. Now, there are 106 family resource centres in Ireland, and probably no two are alike. But that is actually our strength. Our differences are our strength. We are different because our communities are different. Every community has different needs and wishes, as well as different local organisations and agencies around us that we can work with. There is no group or agency out there that can meet all the needs of a local community on their own. But when we work together, we can make a difference. And FRCs often have a unique place in the community where we can bring the local community and the various groups and agencies together. In Meehan FRC in Donegal, it was the tragedy of a local man's death by suicide that became a starting point to many new initiatives. The whole community was deeply affected by this tragedy. And as the people in the Family Resource Centre talked to local people, two things became clear. One, people wanted and needed places where they could just go and meet other people. And secondly, there was a lot of services and activities available, but a lot of people didn't know about it, and a lot of the different groups and agencies didn't know about each other's activities and services. So Meehan FRC brought together 21 different statutory and voluntary clubs, groups, organisations and agencies to inform and to get informed. And this developed into work with the Alcohol Forum. The FRC carried out a survey which highlighted underage drinking and the social pressures leading to this as very big issues in the area. And this, as just one small example, has led to continued work with children and parents and with the schools, focusing on issues such as peer pressure and focusing especially on the very difficult transition between primary and secondary school. Locally also, pubs, hotels and local festivals have become engaged in the areas of responsible serving and underage drinking, and there's been a very positive response. Also, in response to the initial tragedy, Meehan FRC, like Donegal, now provides safe talks and assist training about suicide awareness and prevention. And actually today there is assist training in Meehan, which is why they can't be here today. There has been a very positive response in the local community. People are now much more aware of the various activities and services, anything from dance classes and book clubs to counselling. They know where they can go and meet other people, and they know where they can go if they need particular help and support. And none of this could have happened without partnership. This needed many groups coming together, listening to and discussing with the local community and offering their particular resources and skills. It could be time, it could be space, it could be staff, it could be expert knowledge. There are so many things needed that no one group could ever provide, but together they can provide so much. In partnerships, we share. Sometimes we give, sometimes we take. Sometimes we take the lead, sometimes we take a back seat. Above all, in partnerships we talk to each other. We meet and we inform each other and we plan together. The partnership is, of course, with all the different groups and agencies in an area, but above all, the partnership is with the community itself. That way, the people we work with and for will get the best from us. And that way, the whole community can be mobilised and change can take place. Thank you.
Thank you very much, Karen. Just a point, Karen was referring to Meehan Family Resource Centre and their involvement in the mobilisation project in Meehan. They are also one of the case studies that are on the display stands out at the foyer, if you'd like to have a look and get more information there. Now I'd like to introduce Donna Butler, who's the Programme Manager of Family Matters with the Alcohol Forum, and her piece is about the Strengthening Families Programme and agencies working together for family support. Thank you.
Thank you, Anne. I've been given a warning that I need to slow down with this northern accent, so give me a red card at any stage if I've been going too fast.
Tom understands.
Okay, I suppose what I'm going to attempt to do is just give you an overview of what Families Matter does, and then a sort of a whistle-stop tour of the Strengthening Families programme. And there are many layers to Strengthening Families programme, so I'm very happy to sort of take emails and have conversations after this, but I will attempt in some shape or form to give you an overview today. Okay, so what is Families Matter? Families Matter is a subsidiary of the Alcohol Forum. It is a team dedicated to develop through multi-agency work in the area of family support and change. So I suppose it is completely dependent on multi-agency and interagency work. It focuses on promoting and strengthening family support through evidence-based programmes. So I suppose we see the need for the evidence-based. We know and we want to try and trial models that work, and so they're the ones that we want to implement. Families Matter's core programme is the Strengthening Families programme, and I suppose that's the one that I'm going to primarily focus on today. Okay, the Strengthening Families programme, then what is it? It's an evidence-based family skills strengthening programme developed by Carol Comfort and Associates University of Utah. So what does that mean? It's an evidence-based programme, so it's been around for approximately 30 years. It's worldwide almost at this stage, and in Ireland there have been several hundred families that have gone through the Strengthening Families programme. I suppose its origins was whenever Carol Comfort developed it was where people had come out of a methadone clinic, and I suppose for a very long time hadn't parented their own children. And I suppose as a direct result of that, they developed the Strengthening Families programme. However, 30 years on, we have become much more aware that it is multi-referral, it is multi-agency, and it is at best whenever we have multi-referrals. However, on every programme that we have done to date in the Northwest, we have on all occasions, whenever we have carried out the evaluation, at all times there has been a reduction in alcohol consumption, even though it is not the primary focus and it is just one of the weeks. So it's an intervention for the whole family. So I suppose the uniqueness of it is that the programme recognises that whilst we can build skills with teens and we can build skills with parents, ultimately it's better when we bring that unit together and they make that change together. It's an environment that supports the change whenever they go home. It's a 14-week 3 life skills course. So what does that mean? A 3 life skills course really means that you have parent skills, you have teen skills, and then you have the family skills, and that's the opportunity to practice the skills that you have worked on individually. Families with children, I suppose the programme primarily focuses then with families with children ages 6 to 12 years and also 12 to 16 years. It is interagency dependent and requires agencies to subscribe to a model. Whenever we say subscribe to a model, that really means is that agencies who are involved with families, who are involved with parents and or teens, they attend a 2-day training, and as a result of that, they then refer on to the programme or they help facilitate or group lead on the programme. And I'll come into a bit more detail on that later on. So I suppose what level SFP offers intervention, because often people don't really know where we focus. Model where level 4 looks at intensive and long-term support for families. It is not that, nor is it level 1 where you have universal prevention. It really is where I suppose SFP ultimately provides an outcome-based response for level 2 and sometimes level 3 families. And that really is in level 2 where children have been identified or there's a need within the family. and sometimes level 3 where there are severe difficulties. So that's primarily where it focuses. A typical week then in the Strengthening Families programme is where the families arrive at 6, and between 6 and 6:30 they have a family meal. And I suppose this really is about, without saying it, is about a family communicating, because if we can, I suppose, really develop the communication and the core skills, then anything is possible. Without them core skills, then things become almost impossible. So I suppose we sit down between 6 and 6:30, and as a family they have a family meal, they have family conversation, and believe me, in weeks 1 and 2 that can be a very difficult night for some families who may never have sat down together. They then at between 6:30 and 7:30, teens go and do their teen skills. Parents at the same time do parent skills, and that's between 6 and 7:30. They then come back as a family unit and they practice these skills together, and that runs between 7:30 and 8:30 p.m. Programmes that have said is if we don't allow this opportunity for the teens and for the parents to practice the skills together in a controlled environment before they leave, they are less likely to use the skills out of embarrassment, awkwardness, or their first time to use it. It is more likely to happen at home if it has firstly happened in a controlled environment. So I suppose whilst it's called family life skills, it really is practice skills. I suppose SFP is interagency dependent, and I can't oversell this enough. SFP cannot, will not, and should not happen in Ireland unless it's interagency dependent. And we have representation among education, community, voluntary, health, justice. And I suppose in Donegal we have a very clear snapshot not only of the county but also of, I suppose, of all of the services that contribute to the lives of families. If this doesn't happen, if one of these people if it can't happen, then Strengthening Families isn't at best whenever this happens. So ultimately, I suppose our jobs and our role is to continue to promote multi-agency, the need for multi-agency, and the acceptance that, I suppose, the response to families is not any one services, it's a number of services that bring about the positive change. Developments then in the Northwest since March 2010. We have now 11 programmes that have concluded and have all been evaluated. We have 3 current SFP programmes that have commenced, and there are now 89 families that have finished SFP in the Northwest. There are 240 people from across agencies that have attended SFP training, and between 90 and 95% of these people have either, I suppose, previously, currently, or will be involved. So we have a very active SFP community. I suppose the framework on which SFP is placed then, the Strengthening Families programme, as we heard, is an evidence-based model. However, any model needs to be supported by policies and procedures that not only keep our families, our vulnerable families safe, but also the people that are involved and the professionals that are involved. So I suppose our SFP programme is embedded in policies and procedures. The fidelity to the programme, the Strengthening Families programme is evidence-based. So what I suppose we cannot oversell the fact that we need to be pure to the programme and we need to stick with the fidelity of the programme. It is what works, and if we dilute it or if we do it another way, then it is not SFP. And we have an advisory committee that oversee, I suppose, the implementation, and it's about having the far-sightedness of the programme to be able to move with the times and to be able to move with where SFP is required. The decision of an SFP screening panel, just a very quick synopsis of what the screening panel is. That's where families are referred. It's about the appropriateness of timing for families and whether it's the right time for the family to come along. And look, that reason for referral or for the wrong timing could be for a number of reasons. There could be an episode, for example, where there was someone may have self-harmed. It's about getting the confirmation from other services such as child and family mental health where it's the appropriate timing for the family to come on board. It's very rare that families are excluded from Strengthening Families because we have the flexibility to make sure we adapt to I suppose, the requirements of the families that come on board. SFP induction manuals, this really is about the people who actually come to help and to group lead the programme, that we make sure that everybody's singing from the one hymn sheet, that we make sure that that's where we have the purity and the fidelity to the programme. And again, the referral pathways, if we work with vulnerable families, then we ultimately have, I suppose, a very large commitment, that we make a commitment that we support them in their referrals and that we make sure that that pathway and I suppose that journey is supported through other agencies, and it's not just us in isolation that work towards change for the family. So I suppose that's something that we continue to work on, and the fact that we have 240 people that have now completed SFP training makes it much easier to become involved in services whenever they've already attended. So this SFP model then, I suppose just it ensures compliance with fidelity of SFP and adherence to governance. It allows a programme to be at best when it's multi-agency and multi-referral. And I suppose we, again, see that's so true for the programme. We see it that it's not labelled as a particular programme for a particular thing. It's, I suppose, it's core skills, and it's about building core capacity. And I suppose the Strength in Families developers would say that to reduce risk factors in young people, we must build, I suppose, parents' abilities to nurture and communicate within the family home. So this model also sees the benefit of SFP across many child and family concerns, as I've just said, and it realises the importance of interrupting, intervening and stabilising early, and in particular through an evidence-based model that works. So thank you.
Thank you very much, Donna. And we could all understand it perfectly. I don't know what they're talking about. I'm delighted now to invite Hugh Greaves to tell us about the Ballymun alcohol strategy. It's another way of focusing on alcohol harms. And Hugh is the coordinator of the Ballymun Local Drugs Task Force.
Thank you. I was told to speed up. Donna was told to slow down. So just a quick background. Over the years of the Drugs Task Force, anytime we had any kind of consultation with the local community, people asked us to address alcohol-related harms and issues. And in 2009, we brought different sort of stakeholders from the community together to discuss alcohol-related harm in the area. And that was our first alcohol roundtable event. So some of the people that we had there included people from guards, teachers, youth workers, priests and nuns. So a whole sort of breadth of different people there. That's what it probably looked like. And some of the things that they talked about when we discussed alcohol-related harm in the one community, and I think this is where it's important, when different people are dealing with different aspects, like someone from A&E is dealing with alcohol-related injuries and so forth, that's all they're saying. But when you bring people from different disciplines and agencies and sectors together, put them all in one area and discuss one local community, when you see the aggregated harm that alcohol causes in that community, then you begin to see there's an impetus here, we have to do something about this. We also did community consultation, and including that with them was subgroups of community consultation, such as youth consultation events and so forth. So there was an agreement in 2009 that we would collectively address alcohol-related harm in Ballymun. And we agreed to do that in a systemic way, rather than sort of targeting sort of the risk groups or the needs groups, that we would look at it as a whole community approach. And then we had a series of roundtable events in the following years then to establish a strategy and review and refine that strategy. So that's just another one of the roundtables. So the approach that we're using is it's a public health approach where we're seeking to reduce the total consumption levels in the Ballymun community. And sorry, Joe, quoting you here, a small change to a large population has a greater effect than a large change to a small population. So it's a whole community approach that we seek to take. It's modelled on community mobilisation principles, where everyone has an important part to play and are equally involved in deciding the path we take. And while at the moment it's bottom up because there's no national strategy, we do hope that it will complement the national strategy when that comes into being. The key principles that we're operating under include we're evidence informed. We take a community development in terms of inclusiveness approach. It's partnership based, multi-agency, coordinated, and it's monitored and reviewed at all stages. And then in terms of structure, it's well, the evidence provides the impetus, as I said. When you bring people together and discuss the actual harms, well, then you have to do something about it. You can't walk away and say that was a nice discussion. We have to keep going. So, in that sense, that bottom up sort of impetus is there. There are existing structures that facilitate this, and it's interesting now that the local drugs task forces and the regional drugs task forces have been renamed as the drug and alcohol task forces. So there is a kind of a structure there that can facilitate community mobilisations in different areas. It's multi-agency, multi-sector. it is happening in a community with a long history of sort of cooperation and collective action. There is a steering group, and we do have the annual roundtable. And really important for us is the ongoing mentoring, I suppose, and support that Dr. Ann Hope provides for us. And that's been of immense importance to us in terms of direction of the strategy and so forth. And Ann does that without taking a penny for mileage even, so just to say thanks for that. So, and as I said, we do hope it will complement the National Substance Strategy when it's produced. So the plan was launched in 2010 by the Minister White's predecessor, Pat Kerry. What we're trying to do is we're trying to change the local environmental systems which foster and promote harmful drinking cultures. We're trying to make the local population proactive in pursuit of policy change around their local alcohol environment. And some of the ways we do that, we're trying to increase awareness of alcohol-related harm across the community by local people, local public representatives, and statutory and voluntary agencies. And we're trying to influence the attitudes and norms of the local population towards a change in its own behaviour around alcohol. So we've got 41 actions across pillars: supply reduction, community awareness, treatment and rehab, prevention, education and harm reduction, and policy and research. And I won't go into a lot of detail here. Just for example, in the supply reduction sort of pillar, we work closely with the guards around enforcement of existing laws, and there's quite a lot of them, and some of them are used, some of them aren't. So we're just trying to. That's an ongoing kind of discussion with the guards around what's important. For example, street drinking is a big issue for local people, and getting the guards to take action on that where they may not have seen that as a priority in the past and so forth. Monitoring of off licences. Actions, this is a fairly specific local one around home deliveries, dial-a-can services, and I think it's worth in your own community just investigate what the practice is in your local off sales around some of this stuff. Responsible server training, which is the people photograph at the top there, and then responsible retailer training, the one at the bottom there, and interruption of public drinking occasions such as St. Paddy's Day. Some of the community awareness, again, purposeful use of the media around using local media to get messages across, that hopefully the community can start sort of wagging the dog of the tail of the dog of the politicians, in other words, demanding action at political level for some of the things they're talking about locally. Doing community awareness, raising events, putting key messages in local media as well, such as secondary purchasing messages such as act your age, don't be buying drink for minors and so forth. Alternatives for junior cert night, which has become a bit of an issue where people are buying alcohol for their kids to drink at home rather than have them out in the street. So we're just trying to offer alternative activities on junior cert results night. SIR, brief intervention training for local services, and that's across the board. That's not just specialist services, that's across the board. So where we're trying to get to, well, we're aware that we're a bit of a kinkanute, that there's a huge tide there that we're trying to ward off, and it's you could say we're no cases even trying it, but you have to start somewhere. So and some of the tide is that we do have 16 local outlets, and this would be very typical of other Irish towns as well, in 2 square miles, and 10 of these have opened in the last 12 years. We've got very cheap alcohol and just price-based promotions on that. We've got alcohol deliveries, the dial-a-can services, and in the household study we did of 355 households in the area recently, we found that 1 in 5 has had alcohol delivered to their home, and in the 15 to 24-year-old age group, that's 35%. So that's pretty significant in terms of a new habit of encouraging home drinking. We're aware of the Irish cultural context, and included in that the adult role modelling or modelling that takes place. We're aware in the local context, because Ballymun would be seen as an area with a fairly disturbed history of drug use. People see alcohol as the lesser of evils. More people drink at home and in the pub, and we do have a lot of alcohol marketing that's targeted on the local population. Facebook, again, I would ask you to check out what's happening in your own area around Facebook and how drinks are promoted on it. This is one local off license. This is on Halloween, so customers are asked to note that delivery start at 2:30 today to facilitate the festival. So I suppose just to wrap up then, just to say that in the absence of a national strategy, and I do hope that the Minister announces some measure soon, community mobilisation is our response, and we think it's a powerful local action that local communities can do well in. So,